So we are already studied that the blood supply, blood ocular barrier, and we are discussing the vascular disorder of retina. The vascular retinopathies, okay, it's a group of, you can say, the problem in the retinal vessel. Clear? It's a group of diseases, okay, linked with the damages of retinal vessel. Damages of retinal vessels. Understanding? Now, mainly the vascular retinopathies, they arises in three conditions. Okay, first one, you seen, as I asked you, did you seen the diabetic patient eye or hypertensive patient eye? Their eye is looking different. Okay, their eye is looking bit different. If they are a chronic patient, then their eye is bit different. Okay, looking bit different. Now, so first category of the disease which is closely related with this vascular retinopathies are hypertension, or you can say the hypertensive retinopathy. Understood? Then diabetic retinopathy. Okay, and then sometimes in the pregnancy, there is a chances to develop this vascular retinopathies, and they are termed as late toxemia of pregnancy. Okay, so these are the three diseases, known diseases. There are others as well, but they are the three, you can say, the diseases which is pronounced, okay, which is pronouncedly associated with damaging the retina, retinal vessel. Okay, they are pronouncedly known for damaging the retinal vessels. Clear? Understood? Now we are taking one disease and then understand their, you can say, the pathophysiology, how this retinopathy is arising. Okay, how this retinopathy is arising. Now first we will take the hypertensive retinopathy. See, in the hypertensive retinopathy, what is happening? There is a narrowing of arterioles. Okay, there is a narrowing of arterioles, and due to this narrowing of the arteriole, there will be a less blood supply. Okay, less blood supply to the retina, and that is called as the ischemic condition. Okay, that's called the ischemic condition. So first thing is happening here in the hypertensive retinopathy is the narrowing of blood vessel or the arterioles. Okay, and due to the narrowing of the arterioles, okay, there will be a less oxygen supply. Okay, and that is called as the ischemia. Okay, ischemia is happening, and sometimes due to the high, you can say, the pressure, okay, high pressure, there will be a rupture. Okay, there will be a ruptures of these vessels. Okay, that's called the hemorrhage. Okay, so hemorrhage, understanding, and there will be a inflammation of optic nerve, that's termed as the papilledema. Understanding? So this is about the hypertensive retinopathy. What is happening here? There is a narrowing of the arterioles, okay? Then due to the narrowing of the arterioles, there will be a ischemia, because there is less oxygen supply to the tissue, and that lead to the ischemic condition. Then there will be a hemorrhage, okay, and the optic nerve inflammation, okay. This is termed as the papilledema. Understood? Now let's go with the another class of retinopathy, that is called as the diabetic retinopathy. Diabetic retinopathy. See, here the case is different. It is different from the hypertensive retinopathy. Here what is happening? You know that in the blood vessel, okay, there is a lining of endothelium. Understanding? There is a lining of endothelium, okay, lining of endothelium. Now in the poor control of diabetic, okay, in the poor control of diabetic, you can say there is a microaneurysm formation, okay. There is a microaneurysm formation, means you can say there is a bulging structure here. See, there is a microaneurysm. Small bulging is like occurring in the blood vessel, okay, and sometime it got rupture, okay. This is your microaneurysm, okay, and sometime it got rupture, okay, result into the, you can say the fluid is leaking, okay, or you can say there is a breakage of blood retinal barrier, okay. So blood retinal barrier is broken, and then there is a extraversion, okay, or we can say the leaking out of the fluid into the retinal environment, and that lead to the inflammation, okay, and it also causes the inflammation, means the edema, okay, and there will be a special type of, if this edema will, you can say the rupture, that lead to the special type of hemorrhage, and that hemorrhage is called as the dot and blot hemorrhage, okay. This hemorrhage is called, named special dot and blot hemorrhage, okay. So one of the hallmark of diabetic retinopathy is the, you can say the blocked blood retinal barrier, okay, blocked retinal barrier, and the fluids come into the, you can say the retinal environment, okay, and there will be a edema formation, okay, and that lead to the hemorrhage, and this hemorrhage is a special name, that's called the dot and blot hemorrhage. Diabetes it's a two type. We are dividing diabetes into the two types. The one is called as the type 1, okay, another one is called type 2. The type 1 is called as the insulin IDDM, insulin dependent diabetes mellitus, and type 2 is called as the non insulin dependent diabetes mellitus. Okay, the retinopathy in these two cases are different. Okay, in the retinopathy in these two cases are different. First of all, the diabetic retinopathy, or you can say all the diabetic patients have, you can say all the retinopathy have 20 to 25% higher chances as compared to the normal people that they have the blindness. Okay, let me repeat it once again. The diabetic patient, okay, 20 to 25% higher chance have to develop the diabetic, you can say the retinopathy, as compared to the normal population. Understood? Any problem? No problem. Shall we move ahead? Okay, and the type 1 and the type 2, the basic thing is that in the type 1, almost all the patients with the type 1 develop the retinopathy. Okay, almost all the patients develop this diabetic retinopathy under the 15 years. Okay, within a 15 years, all the type 1 diabetic patients, they develop the diabetic retinopathy, whereas the type 2 persons, they have the risk factor. Okay, they have the chances to have this retinopathy. Now, only the microaneurysms is not only the one thing. Okay, there will be also a loss of the periocytes. Okay, periocytes are present, which is helping to tighten the blood retinal barrier. They are also going to disturb, and there will be a ischemic condition also. Okay, there will be a ischemic condition also, and that lead to the blindness. Okay, that lead to the blindness. So this is about the diabetic retinopathy. Now, and sometimes, as I said, the late toxemia of the pregnancy, sometimes what happening in during the pregnancy times, there is a, you can say the high blood pressure. Okay, that also lead to the microaneurysm. Okay, bulging formation. Okay, ischemia formation. And sometimes what is happening, this is fatal to, you can say, the baby bearing mother as well as for the child. So sometimes there will be a need for the termination of the pregnancy. Okay, termination of the pregnancy. About the maintenance of, you can say, managing the vascular retinopathy, there is a need to control. Okay, there is a need to control, okay, the blood sugar level. Okay, good metabolic blood sugar level. Okay, and if there will be a severe extraversion or fluid leakage, okay, then there are the surgeries. Okay, there are the surgeries by which this fluid will be cleared out. This, when there are some thrombolytic, you can say the medicine, okay, that will dissolve the edema, or you can say the clot. Understanding? Okay, understanding, no problem. Now, apart from the vascular retinopathies, okay, there are some vascular disorders in which there is a direct occlusion, or you can say the obstruction. Suppose you seen that from the heart, the carotid artery, okay, from the arch of aorta there is a carotid artery, they are going to give the ophthalmic artery. So sometimes there will be a obstruction of ophthalmic artery. Okay, you know that embolism. Okay, embolism. Okay, there are different types of embolism. You can say the air embolism, okay, fat embolism, then blood embolism. Blood embolism, special have name, they called as the thrombi. Okay, so sometimes what happens, this embolism in the case of arterial fibrillation, okay, and sometimes the carotid, you can say the carotid artery problem. These embolisms, they comes and they directly goes to this ophthalmic artery, and they obstruct the ophthalmic artery. Okay, persons have instant, you can say, a blindness. Okay, blindness. So that's one of the reason, and some embolism, they are going to block the retinal artery, okay, and persons developing the papilledema and the blindness. So these are the some diseases related with the blood supply of eye, okay. So let's conclude the class. In the today class, we studied about the blood supply of eye, and we seen that the ophthalmic artery is the main branch, okay, which is giving the different branches to the eye, okay. Second thing, we studied about the blood ocular barrier, that the eye environment is need to be separated from the blood environment. Understand? For that very purpose, there will be a one physical barrier, and that barrier is called as the blood ocular barrier. This is a two type. One type is called blood aqueous barrier, another type is called as the blood retinal barrier. And we see that in the case of diabetic retinopathy, there will be a rupturance of these, or you can say the brokenness of blood retinal barrier. That's one of the hallmark of diabetes, okay. That's one of the hallmark of the diabetic retinopathy. Then we've seen the different kind of retinopathies, and we defined that basically the vascular retinopathies are group of disease, okay, which affect the retinal vessels, we've seen that hypertensive retinopathy, we've seen diabetic retinopathy, we've seen that the late toxemia of the pregnancy can also lead to the retinopathic condition. Then we've seen some of the obstruction, occlusion or obstruction related with the ophthalmic artery, okay, and the central retinal artery. So by this we finished with the eye, okay. Thank you with having me. Bye. Have a nice day.